Preventing Stroke Part
Stay
1.
safe, stay alive. Welcome to once again another session with your favorite doctor, Dr. Fresh, and today we'll be doing a very interesting concept called stroke. So what is stroke? A lot of people there's a stroke, the person had a stroke, they don't really understand the concept, so I'm here to unravel what stroke is all about to you in this first part. So what happens in stroke is this: it principally occurs in the brain. The blood in the brain flows. As it flows, it gets to a particular point, there's an obstruction. Because of the obstruction, it impairs the blood flowing to supply the part of the brain. So the blood flowing contains oxygen, contains nutrients. So that part of the brain is deprived of oxygen, is deprived of nutrients. So that part of the brain begins to suffer. As it begins to suffer the lack of oxygen and the lack of nutrients, to a certain extent, the part of the body it controls begin to suffer the consequence. So you see, this person has a stroke, has these symptoms. This person has a stroke, another set of symptoms. Is to the part of the brain that was deprived of blood supply, and to the extent. And that's why some persons have a partial stroke, while some persons have a full stroke. How do you know a person has risk of stroke? Or what are the factors that put you at risk of stroke? First of all, your lifestyle. If you smoke cocaine, you take nkburu, that stuff in the East, a lot of people take, a lot of young people. Just know that in the nearest future, you could really come down with a stroke. If, as a person, you are obese, you are very big, you are at risk of throwing a clot that can block the blood supply. That is, your body can release something that can block that blood supply and can lead to the stroke. Then another thing happens is if you are overweight, as I said, they are obese, overweight, and that strength, there is a problem. You have blood pressure. Almost 95% of persons who have had a stroke once had a poorly controlled blood pressure. You are diabetic. You are an active smoker or a passive smoker. Either you smoke on your own or you sit down where people are smoking and you inhale the smoke, then you're a passive smoker, you're at risk. If you're somebody that uses contraceptive that is rich in estrogen, just know that in the near future, you're setting up yourself for a stroke. The list is so long, but in this first part, I want you to know that you can escape this life-threatening dilemma that has befallen the human race. Watch out for part 2, subscribe and keep watching.